The Armed Forces Remembrance Day, observed annually on the 15th of January, honors the sacrifices and service of Nigeria's armed forces, both past and present. The officers dedicate their lives to safeguarding our nation's peace and security, often at a great personal and emotional cost. However, their huge personal and familial sacrifices often go unnoticed and underappreciated by the majority of the populace. It's on account of this recognition that the Asido Foundation seeks to extend appreciation to our armed forces in a manner that not only uplifts their spirits, but also improves mental health awareness within their ranks, while improving empathy and civic appreciation amongst Nigerians. Well, to discuss the issues bordering the mental health of active duty military personnel and also the need to celebrate not just the dead, but also the active servicemen, is Dr. Jibril Abdulmalik of the Asido Foundation. Good afternoon. Thank you for joining us.
Good afternoon. Thank you for having me.
And what a wonderful intro explaining why Armed Forces Remembrance Day is important, especially remembering the families and all the sacrifices that have been made on the part of our armed forces. What particularly does the Asido Foundation do, and why is it so important for them to highlight the work of these brave men?
Right. Thank you very much. So the Asido Foundation is an NGO that promotes mental health awareness and advocacy. And that is because the definition of health by itself, by the World Health Organization, states that health is a state of complete physical, mental, and social well-being. So those three components, so health is actually a tripartite entity, but we all tend to focus on our physical health. If we say we're going for medicals, we mean we're going for physicals. Hardly anybody goes to hospital and says, oh, I want to have a mental health checkup. I want to check if my social life is okay or if I need to make adjustments. But we do physicals. So the idea that mental health is an integral component of health, yet it is often overlooked, neglected, and particularly in our society in Nigeria, there's a lot of shame, stigma, and discrimination associated with it. Some people, once they hear, "Meh, you've not even completed the mental," they say, you know, they start saying you've completely lost your mind, you are insane, and so on. But that's not what mental health is. So the Asido Foundation aims to promote awareness in our society, promote empathy, ensure that there is no more shame or stigma, and that everybody who is going through a mental health challenge is able to seek the help they need openly without fear of shame or discrimination.
Not very well said. Coming to the issue of our men and women in uniform, what sort of support should be given to wounded soldiers, you know, or those suffering from PTSD?
Right. Thank you so much. Again, this is often a neglected component of our service to the men and women, gallant men and women of our armed forces. We know that behind the uniform is a human being. And every human being has emotions. And when they go into very stressful combat situations, war, and all of that, it takes its toll on their emotional well-being. However, even just looking at the statistics in terms of the number of mental health professionals within the armed forces, it is very scanty, negligible. Maybe 2 psychiatrists in the Army, maybe 1 or 2 in the Navy, the Air Force, NAIL. So when you look at these numbers, it's really grossly inadequate. And we need to pay attention to their mental well-being because they are the ones that are invested in putting their lives at risk, providing service to keep all of us safe so we can all sleep safe and sound in our homes and protect the territorial integrity of our nation, both from internal and external aggressors. So we have to ensure we owe a duty of care to these officers and men to ensure that they get the best quality of care, not just for their physical well-being, but also for the often invisible emotional injuries that they also suffer from.
I'm actually wondering what kind of resources are even available to the officers, even their families, because we know that this
Absolutely.
affects the families, not only when they pass away, but when they come back. We know that the things that they might have seen, torturous things, affected the way that they present themselves in their families and their lives. Are there resources also for the families of the soldiers?
Unfortunately, very few. These are some of the things that the Asido Foundation is trying to start with this campaign to create awareness about it so that they can be developed, because primarily we need to prioritize the soldiers. We also secondarily, as you very correctly mentioned, look at their families, their spouses. They are away for months. Their children don't see them. Their spouses don't see them. They are not sure if they will come back alive from the theater of operations or the combat where they've gone. There's a lot of stress on the family members too. And if you compare with veteran mental health in the US, for instance, where they have a lot of resources, online resources, websites, dedicated services for active military officers, for retired veterans, and for their families, we don't have anything close to it. We don't even have sufficient numbers of mental health professionals within the armed forces. But part of what we are trying to recommend is that you don't have to employ all the psychiatrists and all the clinical psychology. We can be pragmatic. We can collaborate with mental health NGOs like the Asido Foundation, with specialist hospitals in different cities across the country. It can be a partnership, an arrangement where they get the quality expert care they need when they need it.
But then I'm wondering, what role is the government and also the private sector, what role are they expected to play in this? Absolutely.
Now, in Nigeria generally, both for civilians as well as the armed forces, mental health is neglected. And that is part of the reasons why we are shouting from the rooftops, right? That the government needs to prioritize attention to mental health for every citizen, but in this case, especially for our armed forces. So we need the government to prioritize. And if they prioritize it, they can do targeted recruitment of mental health professionals within the armed forces to improve service delivery, you know, apart from partnerships and so on. So the first thing is for them to recognize that it should be a priority. And that's part of this campaign. I'm very happy that your station is giving it this opportunity for us to focus on mental health of the armed forces. So government needs to prioritize, government needs to fund, because services do not come cheap. If you have to put your pocket where your mouth is. So if you say you are committed to providing services, you'll have to fund those services. So that's one. The other thing that the government and the military hierarchy also need to do is to create an environment that is open and devoid of shame and stigma, because most people, the training of military personnel is such that you shouldn't show pain, you shouldn't show emotions, you should be an efficient fighting machine. But we know they are human beings. And all over the world, we know that they will have emotional difficulties and challenges. So we also have to have a safety net, a buffer to catch those who are going through difficulties and provide services for them. But that also has to come from the hierarchy. The fact that we're opening up the conversation, these services are there, we are going to support you, don't be ashamed or embarrassed to come forward, because if that enabling environment is not created, those who are suffering are going to continue suffering in silence.
And this might be why more women might be needed in armed forces. And I say that because, just like you said, the perception of the military is so macho, so alpha male. And
Absolutely.
Within these purviews, there are characteristics of not being seen as someone who has issues with mental health or has physical issues. You know, you're supposed to be a strong man.
Yeah.
So in order to change that perception, it seems like it would be quite an uphill battle just because of the nature of the profession. But my real question is the use of technology, because obviously that is a really quick way to solve problems in this day and age.
Right.
We have people who are logging on to AI or Chat GPT as their personal therapists in this day and age. In case you weren't aware, how can technology be used to maybe take some of the pressure off the government in terms of prioritizing and get it into the hands of more technical individuals who can bring this to the fore?
Right. Thank you very much. Let me just start from the issue of the gender. I very much support that. And I will say on record that the first female general in the Nigerian army was a psychiatrist, Major General Aderonke Kale of blessed memory. She passed away, I think, a year or two ago. You know, so that's just on the side. But you're absolutely correct. We need to leverage technology. But leveraging technology has to be done in a systematic and coordinated manner. And I think that that is actually where the military hierarchy can partner with professional associations, like the Association of Psychiatrists in Nigeria, the Nigerian Association of Clinical Psychology. So we know that they are certified professionals who are engaging. And then if I'm in Lagos, for instance, and there's a military personnel in Maiduguri or in Enugu or Calabar who needs attention, we can have a Zoom session and deliver therapy without having to physically go there. So those are ways that we can leverage technology, leverage partnership with professional associations, and also the AIDO Foundation, for instance, to provide a manpower so that we are sure that the information and the service they are getting there's quality assurance of professionalism.
Now, very well said. Before we let you go, I would just like to ask a general question on ending the issue of stigmatization regarding mental health. And then how do we also draw a line between selfishness and toxicity that exist all in the name of preserving mental health? Very briefly, please.
Right. So let me say that the Asido Foundation is launching a campaign for the military to appreciate the military, and it's a 1-month-long campaign, January 15th to 15th of February. If you see a military man anywhere on the streets and so on, just walk to them and say, I thank you for your service, I'm grateful for your service, and all of that. It's so little, and we all can do that, and it won't cost us anything. So let's try and do that. Now, with respect to shame and stigma generally, that is what the Asido Foundation, that's the biggest, our people perish for lack of knowledge. Right? So the biggest barrier is ignorance. But once you shine a torchlight, you dispel the darkness. So we really all have to promote open conversations about it. The more we talk about it, the less it's, comes out, the less it becomes something that's spoken about in hushed tones, only in the shadows. Let it have sunshine, and let's dispel the myths and misconceptions so that there's open conversation. Now, selfishness. I think some people, when there's a buzzword, sometimes it catches fire and people just use it as a buzzword. We really have to be very critical about how we use those buzzwords, to just not use it as a get-out-of-jail card. Every time you don't want to do something, you say, no, because of my mental health, I don't want to do this. So there needs to be some check and balances. But again, we don't want to say anytime someone is saying that, just dismiss it. Because sometimes perhaps there may be some truth to that, and that person is actually in a vulnerable state, and we have to be considerate and show empathy. But again, it's not a get-out-of-jail card to be used by every Tom, Dick, and Harry all the time. So I think it's finding the middle balance, the middle road. Thank you.
Very well said. It was great to have you on the program today. Thank you so much. All the best with your foundation. The founder and CEO of Asido Foundation, Dr. Jibril Abdulmalik. Thanks for joining us.
Thank you so much.